watching the It's Her Time podcast with Cody and Jess. Welcome back, everybody. My name is Cody Sanders, and I am a holistic health practitioner and functional nutritionist and the host of this show. And today we are going to be talking about how we can better understand our blood work so that we can better understand our health. I've invited Dr. Patricia Schneider on the show today, and she is an expert in holistic health and functional medicine. With her extensive experience and unique approach to healthcare, Dr. Patricia is eager to share her insights with us and to empower us to take control of our health through carefully reading and understanding our blood work. But before we go into this, let's join Jess for a Mixhers Girls Say.
On today's episode of Mixhers Girls Say, we're actually going to talk about your travel must-haves.
Mm-hmm.
And I shared this the other day on our Mixhers Instagram stories, the products that I have to take with me no matter where I go. I mean, usually I take quite a few products.
I do too.
But this was a less than 24-hour trip that we went on to Arizona.
Yeah.
And so I shared that on this 24-hour trip, I made sure to take my Her Time, my Her Greens, Her Digest, and Metabolic Balance. Those are the 4 that I made sure I packed for a 24-hour trip. But I asked women, what are your musts? What do you travel with? And so here are some of the responses. What do you travel with?
Oh,
Everything?
Always her. I do. I feel like I have my own suitcase just for the supplements because it's part of my just daily routine. And I find when I'm traveling, I'd like to keep that consistent.
Yep.
But Her Time, obviously, Her Thrive. If it's a trip with my honey, then I make sure to have Her Pleasure.
Wow.
And, I love having the the digestion. I mean, I literally could just name them all.
Yeah. So women wrote us. Cheryl Bow said Her Guard, Her Power, and Her Thrive must have.
Her Guard. Yes.
Yes. While you're traveling.
You can, especially on planes. Yeah.
Mm-hmm.
Mm-hmm.
I don't know how to say this Instagram handle, Mikkel something. Her Hydration. Then Taylor, everything. I must drink Mixhers every single day. Bethica, Her Time Extra Strength, Her Thrive, Her Multi, Her Digest, and Her Pleasure always.
Yeah.
Sid, Greens, Her Guard, Her Digest, and Her Hydration. Adorned Life Boutique, Her Multi, Her Guard, Her Time, Her Power, Her Hydration, Her Digestion, Her Greens, and Her Pleasure. Yes. There's quite a few, but Natalie wrote Her Greens and Her Hydration. It is so important on a trip while you're flying and all the things to stay hydrated.
You just feel so dried up like a little raisin. You got to make sure that, you're staying hydrated.
Yep. There's quite a few women that wrote Her Boost. There's a lot of women that wrote Her Time. This woman, Caitlin, cannot and will not skip out on my Her Greens and Her Time every single day. Yeah. So it does seem like Her Time is very consistent.
Yeah.
And we just love that you're taking Mixhers along with you. We're grateful to be a part of your trips. Yeah. We agree with you. You can't go without it once you forget. It's actually funny story.
Okay.
When I went on this trip to Arizona, we were hosting women for a Mixhers event. And I had 2 different conversations where women were sharing with me. One woman went on a 2-month trip.
Oh, wow.
She's been consistent with Her Time for 2 years. She went on a 2-month trip, forgot her Time. And she was like, I will never forget it again. She was like, even my husband was like, what do I need to, they went overseas. And she was like, even her husband was like, what do I need to do to help you get your Her Time? And she was like, it's not that I didn't think Her Time wasn't working for me. Cause she's like, I've loved it and I've used it for 2 years, but I realized why I'll never stop taking it. And so that was her experience. And then another woman shared with me her experience with being consistent with Her Time, even while recovering from a surgery.
Mm-hmm.
She had 1 month where she wasn't as consistent because she was just so nauseous and sick on all of these medications and things recovering, had a period while recovering, and it was terrible. So the next month, she made sure to stay up on her Time while also doing a lot of her aftercare from her surgery.
Mm-hmm.
And she said that it was just so much better not dealing with all the PMS symptoms while also dealing with a painful recovery.
Yeah. Well, and the nice thing too is, we want to take every single product that Mixhers, has, but they're designed to be portable and they're small little sticks. And so it's actually easy to take everything with you.
Yep.
That was done on purpose. We are women. We understand.
On the go.
On the go. We need to take our health with us wherever we go. So, yeah.
So thanks for taking us with you. Enjoy the episode. Mixhers is a company made for women by women. Each of our products have been carefully and lovingly crafted to support you in all stages of your life, providing you with the optimal health you deserve. Each ingredient we handpick is 100% all natural, backed by science, and chosen specifically to better your life physically, mentally, and hormonally. Each product empowers your body to take charge of its monthly hormonal shift and flows, empowering you to live life to the fullest. Let Mixhers take care of your needs from sunup to sundown, and you take care of the rest. Check us out at mixhers.com, Mixhers.
All right, women that are tuning in today, you girls are in for a treat because I have Dr. Patricia Schneider on, and she goes by Trish, so we're going to call her Trish today. But as you know, I know there are so many of you that reach out to me on a pretty regular basis, wanting to have better understanding of what it is that we're actually looking for when we're getting all of that lab work done, and we're trying to understand what all of these numbers mean, especially when we're feeling like we're experiencing a lot of symptoms, and then we get our lab work back and our tests come back normal, right? And we're like, what does this mean? So I'm excited because Trish is an expert on this. And so, yeah, say hi to everybody. Tell us a little bit about you and what your expertise is and what we're going to talk about today.
Yes, of course. So thank you so much. And welcome to everyone who is listening today. So I've been a practicing nurse for over 25 years, and I worked in the hospitals, and I worked with adults, and I've read a lot of blood work and things like that. And so what I've done more recently is I've become a nurse practitioner for the past 3 years, and my specialty is psych mental health nursing. I work with children and adolescents and also young adults. And what I was finding was that many of my patients, especially their parents, they would come to see me because their child had trouble with their mood or ADHD or what have you. And parents are looking for alternatives to the traditional medications that I prescribe for them. So things like stimulants and, other things that can have so many side effects. And parents were really asking, well, what do you know about alternative or functional, natural supplements? And I'm like, wow, I really don't know that much about it because my traditional training as a nurse, it wasn't that way. It's, here's your symptom, this is the treatment, here's the options, here's the medications. And even looking at blood work, we were just, we taught in nursing school, these are the numbers, this is normal range. And if it's anywhere in between that range, we don't really look at it. Regardless of whether you have symptoms or not, it's just not something that's addressed, and it's used to diagnose more than anything. And I really became interested in learning more about functional medicine and also really looking at the labs much more closely. And I really like the functional aspect of the labs because it's different from traditional lab work that, you're within normal limits, but functional is optimal, right? So just because your labs are within normal limits, it doesn't mean that your value is at the optimal function. So it really, so it really has opened up a lot more opportunities. So that way I can provide patients and parents and clients that I work with just some additional answers to their health concerns. Many times my doctor tells me everything is fine. I've got X, Y, and Z, and everything is normal. I don't know what else to do. So it's really fabulous because your blood work is really a gold mine of information if you know how to read it correctly.
And that's what we're here for today, because
Yes.
I know that there are so many of us that, we don't have that education. We don't have that understanding. And it just feels kind of frustrating. And sometimes it can feel like a waste of time and money to, consistently have this blood work done and then have it not really give us the information or the gems of wisdom that you're talking about, that there's so much more that we could be understanding with the blood work results that are coming back. And so I'm excited for you to kind of dive into all of this with us, because I do think that this is going to really empower so many of us. I always am like, we need to be our own best health advocates. And this is part of it. This is going to help us all be able to understand, but also know what to ask for, so we can keep asking questions to our, our health care practitioners. So let's go into it. I'm excited.
Yes. Okay, great. So normally what I do is so these are labs that, any practitioner should be able to get. So we want to make sure that we're getting a complete blood cell count. So that's a CBC with differential. That's what we want to get. We also want to make sure that we're asking our doctors for a thyroid panel, an iron panel, also a blood sugar panel. So that'll check, our glucose levels and our, metabolic symptoms. And also, I'd like to ask too for a hormone panel, and not just testosterone, but the whole hormone panel. And then what we can find from there is I teach some workshops in which I, go through 5 markers in the CBC that can give us answers that we may be looking for. So, for example, one part of the CBC, we look at white blood cell count, and white blood cell count can determine whether or not we have an infection. But then we go through each one of the white blood cell counts to really see what's going on. So, for example, the first lab that we look for is neutrophils. And these are white blood cell counts that can determine whether we're fighting a bacterial or a fungal infection. And these infections are not going to be flagged in the normal labs as, abnormal. But they're there. They're wreaking havoc. So, for example, if your neutrophil count is above 60, which is the range that we like to do, you can have symptoms of a messed up gut. So, GI stuff. And many times, a lot of us do constipation or bloating. Right. Maybe it was something I ate. Who knows what it was? Or it can even be joint pain. So that can be an underlying bacterial infection. Lymphocytes is another marker that has really a lot of information, and that one can determine whether we're fighting a viral infection. And this is another one that can be just below the surface. It's not going to test positive, but it's there and it's wreaking havoc. And viral infections, chronic viral infections, low-grade infections are really the biggest trigger for autoimmune disease. Like things like Hashimoto's, right? Autoimmune, direct relation to the gut, and those are things that we're not really looking for as traditional physicians or practitioners, right? Monocytes is the next gold standard in the white blood cell count, and this looks for viruses like Epstein-Barr. So in order for Epstein-Barr virus to show up positive on a test, it has to be 12 or higher. But if it's low grade, again, still causing fatigue, no matter how much sleep we're getting or how much we change our nutrition, we're still feeling exhausted. We still have trouble getting up out of bed in the morning. And again, we just don't know that it could be these possible underlying infections too. So, there's a lot of hidden gems in the blood work. We just have to really look and see, is my level optimal? Because if it isn't, then, I like to provide guidance in specialized treatment plans to get people, feeling better and where they're going to feel their best.
Yeah, I agree with you, Trish. I know when you're looking at the normal range, like what you're saying is that the normal range can be a pretty big range. And so if you're down on the lower end of that range, you still could be falling in the normal range, but you are not optimal. And so there's so much we can do by understanding these tests, like you've just done such a great job of explaining to us, but then also making some modifications, whether it's through lifestyle strategies or through nutritional therapy strategies. All of this can definitely put us more into that optimal range. And then we start seeing that some of these symptoms that are maybe keeping us, sidelined are kind of disappearing because our body is feeling like it's more balanced. And so powerful. Yeah. Exciting.
Yeah.
Yes.
Another one that I see a lot of is vitamin D levels. And just as an example, because you were talking about these big ranges. So normal vitamin D level is anywhere from like 32 to 100. And that's a huge range.
Huge.
Optimal is 80, but as I started really looking at people's blood work, especially people that were coming in with, gosh, I'm irritable. I have anxiety. I feel depressed. I feel down. I've tried all these medications and nothing works. And I have seen so many really deficient vitamin D levels, which can lead to those exact symptoms that people are experiencing. So sometimes it's a matter of let's get your vitamin D level optimal and let's see what sort of an impact it has not only on your mood, but also on your immune system, which is so important too. And these are things that we just don't really look at and we miss. It doesn't become the priority. And there really is so much more to our blood work than we think. So
yeah, and I love that you're sharing this because the way that you feel at 32 as opposed to like a higher vitamin D level is incredible. And vitamin D is so important for so many other aspects of our health as well. And so it could just be that little underlying thing that's going on that's not getting found and not being addressed. But how many people would you say, I know for me living in Utah, how many people would you say that you are helping are vitamin D deficient?
Oh my gosh. I think everyone is deficient in vitamin D because I have not seen anybody near an 80. I have seen things like 20. I saw one lab range recently last week that was a 7. I'm like, how are you even functioning? So yeah, I think the highest I've seen is probably like 50. But sure, depends on where you live, how much sunlight you're getting. And so, yeah, I think the majority of us are deficient in vitamin D, and we could all use some vitamin D for sure.
Yeah, I agree. That's my experience as well. And vitamin D isn't the only nutrient deficiency that I'm sure we can see when we're looking at the blood work, So let's dive into that because I think, I talk a lot about on this podcast about how nutrient deficiency affects our hormone health, right? It affects a lot of things other than just our hormone health, although it's all connected. But I'd love to kind of get your insights on exactly what it is that you're looking for and which nutrients specifically that you're looking for when you're reading these labs.
Yeah, so those 5 markers I look at, monocytes, basophils, eosinophils. These are also other ones that can determine whether we're fighting a parasitic infection too. So if you've had GI symptoms and you've pretty much eliminated everything in your diet and you're still having trouble with digestion or what have you, sometimes looking at the blood work can determine if there's like a parasitic infection going on too. Another thing that I find many times is thyroid, right? So many people that I work with and have met throughout my career, I can't lose weight. It's probably my thyroid. I find that the thyroid gets blamed for a lot of things. And it really does have an impact on our hormones. Sure. But when we look at the way that the thyroid functions, we're really not getting to the root cause of why the thyroid might be underproducing or not, given the essential nutrients that it needs. Mm-hmm. Because we try to treat thyroid disorders at the bottom of the food chain. So when we think about thyroid disorders, we really want to look at the hypothalamus as part of the thyroid, the pituitary gland, which produces the thyroid stimulating hormone. People think it is a thyroid marker, but it's not. It's the pituitary gland, thyroid. And then again, just looking at how converting T4 to T3, and T3 is so important because T3 goes out and talks to every cell in the body, regulates our body temperature, tells our metabolism to speed up. So when we look at problems with the hormones and potential thyroid, we really have to look at a bunch of other factors. We have to look at the top of the food chain. What is preventing the hypothalamus from getting the two really important hormones, which is serotonin and dopamine, the happy hormones that start the beginning of the food chain, right? So we have to ensure that the hypothalamus is getting the serotonin and the dopamine, and that is definitely linked to depression and anxiety. Mm-hmm. And the places where serotonin is produced and stored a lot is our gut. So when people say a brain-gut connection, that's exactly what that means. How many times, like if you're anxious about a test or something coming up and you get a stomach ache, right? That's your brain directly talking to your gut. So sometimes we want to look at what is our gut health like? Do we have a healthy bacteria that's supposed to be doing all of the things to keep our gut healthy? Is that why we have symptoms of depression? Because our guts aren't really in great shape, and that is changing the way we're using serotonin, right. So that could be another factor. Also, dopamine, is another one stored mainly in the brain. So we want to look at, well, what could be causing, my body to have trouble getting the serotonin and the dopamine that it needs? Is it my gut? Is it my liver? Because it has to convert there. It is my hypothalamus talking to the pituitary gland? Is the pituitary gland having issues talking to my thyroid? So really, we want to feed the top of the food chain from the top down, because what thyroid medication does is it treats the bottom, right? So really the only people that need to take thyroid medication is if they don't have a thyroid. And really, besides that factor, there are other things that we can do to supply the body with what it does naturally. We just have to give it the tools in order for the body to be able to do that. So
I love that you brought that up.
Yeah.
I love that because I feel like a lot of thyroid medications are just being given out like candy. And so, but you're right. It's all connected. And that's what you're explaining, Trish, is just like, it's our gut, it's our brain. It's, it's the whole HPA axis. Everything is working together. And so there's so much that we can dive into a little bit deeper. And that's what it means to take a root cause approach here. And this is what Trisha is talking about when she's saying, we're starting from the top, not from the bottom. It's that we're trying to figure out where it's stemming from, because it can manifest, all of these imbalances can manifest themselves in lots of different ways. And so it could be all of these things. It could be poor liver function. It could be that the thyroid's not functioning optimally, but why? You have to keep asking why. It could be that there's an infection in the gut. There's just a lot of things. And so having somebody that's like Patricia to like understand these labs and help guide you through this is invaluable. And I encourage every woman that's listening today to, if you haven't found a healthcare practitioner that's knowledgeable in all of this and who wants to take a root cause approach or a functional medicine approach, keep looking, because there's a lot that we're missing. And there's so many, like she said, so many hidden gems that are in our blood work that, that we're not even paying attention to, but really that's where the gold is. That's where we're going to really understand what's driving everything that's happening within our health and our body. So I love that you brought that up.
Yeah, absolutely. And really, with healthcare and even how we go about it in general, is we're looking to treat the symptoms, so we're not really delving into, well, what's causing this really? Let's really look deep and figure out what's causing it. We're almost like, we're at the end of the food chain, so it's so important to just really, everything is connected. Every cell in the body talks to everybody. So it's really important that we ensure that the whole body is working together efficiently, because any problems in one area will have a direct impact on another area. So it is really great to take this whole approach and just really try to get to, what are some other answers? What are some other reasons for why I'm feeling this way, rather than just the Band-Aid on something. Like, I feel like,
yeah, sometimes we need the Band-Aid just to kind of help us get through, but that's
absolutely.
not the end all be all. That's not where we should end the, trying to discover. We need to just keep digging. And so, yeah, sometimes I always say it's best to, to test rather than just to guess. But you need to make sure that you're doing this testing with somebody that actually understands all of this as well. Because otherwise we're, like I keep saying, we're just going to be very frustrated. And I feel for all of you that write into me all the time, just feeling that frustration and, all of that. But okay, I want to dive a little bit more into it because you mentioned it. And I think that it's something that so many people also are experiencing. And it's a lot of anxiety or mood disorders or things like that. And a lot of times we've kind of thought that it's just something that's going on with the brain. But we just had Dr. Caroline Leaf on our podcast, and I love what she talks about. She talks about how to clean up your mental mess. But let's talk about all of this and like how powerful nutrients are, or food is when it comes to our moods. And so like what nutritional deficiencies do you commonly see, or vitamins deficiencies that you see that are affecting our moods?
So I mentioned the vitamin D level. I see that as a big deficiency. Also, it's important to look at our B vitamins. So B vitamins is another one of those vitamins that I do find that, people can have fatigue. They have trouble concentrating. They're depressed, memory problems, skin issues. And, it could be related to vitamin B deficiencies. And, thankfully, it is easy to correct them through diet and through supplementation. But in order to develop a B, vitamin deficiency, sometimes it's a matter of our diets. Our bodies are not able to absorb the nutrients appropriately. It could be because we have gut infections. It can even be because of medication use as well. So having our B vitamins checked, I think, is super important too, because that also has a huge impact on how we feel, not only physically, but also mentally, and also whether our brain is, alert and oriented and able to focus. So all of those things too are important as far as making sure that we're having, those good vitamins. Omega-3s too, very important to have because those help with inflammation. And it's really hard to avoid eating foods sometimes that cause inflammation, or to breathe, air that's not, completely clean. So it can cause all of these, inflammatory responses in our body. And just having inflammation alone can cause, a lot of the symptoms that we're feeling as well. So I would say the omegas, the B vitamins, the vitamin D12, and the CBC with the differential that shows, whether there's an infection. Is it like a parasitic infection? Could it be something in our diet? Is it, vitamin D? So those would be important too. And also, I would say the iron panel too, making sure that, we have enough iron-rich foods in our diet, green leafy vegetables, enough meat and protein, because that can make us feel fatigued. And it can also, if we have low hemoglobin and hematocrit, can put us at risk for even a heart attack, So an iron panel as well, I think, is very important. That could be alone the reason for someone's fatigue and not really feeling optimal and just really having trouble focusing and concentrating. There's just so many things that could be contributed to.
It's so true. And I agree. I feel like those are all the, the nutrient deficiencies that I have run into as well. And, people that are low in iron, which can be very common for women who are experiencing a lot of heavy bleeding with their menstruation, or if they're going through, perimenopause or menopause, or if they're just dealing with very high stress loads. That's something that also is affecting. And usually these women they feel like they cannot even get out of bed. They're just so tired. And a lot of times they describe it as like feeling bone tired. So it's more than just like, oh, I need to go take a nap. It's just that energy deep within is non-existent. And so iron is very connected, but same with the B vitamins, like you're saying. B vitamins are, what help us with energy, vitamin D, all of it, it's all connected. That's for sure. So do you ever recommend that people also do any type of liver health panels? Because I know for a lot of women who are deficient in vitamin B, a lot of people have trouble with methylating their B vitamins specifically. And so their body's not able to absorb, because you briefly touched on that, but do you mind kind of going into that just a little bit more?
Yeah, I agree. It could be the matter of our bodies not able to absorb those nutrients. And we do want to look and see how the liver is functioning. And usually when I want to work on my clients and my patients, I do a full workup, and I do also include the liver, just because it's so important in like converting a lot of the hormones and producing hormones and things in the body. So when I do see that people have low vitamin B levels, I do check that. And many times I do see that there's a correlation. So their body maybe is not able to absorb it or, really use it properly. So it's really important to make sure that our liver is functioning well, especially if we're getting into a treatment plan where we're having to maybe clean up the infections, right? Because some programs, when patients have an underlying infection or whatever, any one of the markers that are off, usually what I do is I provide a treatment plan for them that's about 90 days. It used to be done a lot longer than 90 days, but we're able to do it in 90 days. And that first step of the process, that first 30 days, is gear up. So this is when we are providing support, immune support for the body in order to prep the body, in order to be able to detox in the second month. So the first month, we provide antioxidants, we provide omega-3, we ensure that the liver and the kidneys are also functioning well, because we're going to be prepping those for detox.
Yeah. Mm-hmm.
And then in month 2, usually what we do is we include any anti-infective, supplements. We do gut motility activation, so we get the gut sort of ready. We do a complete GI detox. We try to reset that microbiome in month 2. And the reason for that is when we go through the detox program, we want to prevent those toxins from getting reabsorbed.
Right.
So again, looking at the liver and ensuring that it's going to be able to handle this process is so important. And then in month 3, what we do is we call it a revamp. So we are going to provide immune, probiotics, replenish the minerals, regulating the hormones, and really providing the body anti-inflammatory nutrients too. So looking at liver for sure, we have to make sure that our liver is going to be able to handle the process of going through all of this and absorbing the nutrients that it needs to absorb too.
Yeah. I love it. It sounds like an awesome program. I'm excited for the audience to look into these programs that you offer, because I think it's one thing to have all of this information when we're looking at our blood tests. It's great to have information, but then you need an action plan. You need something that is going to help you know what to do about what it is that we're finding out. And so I think that's incredible that you have this. And so I will definitely be linking all of the different programs that Trish offers for all of us. And obviously the ways that you can connect with her. She's just putting a lot of good things out into the world. And so everything that you're saying, I'm like, yes, this is so good. And I love that there's people out there that are doing this in the right way. If you enjoyed this episode, I hope that you are wanting to share this episode with all of the girls in your life, because this is something that is good for all of us to know. And when you guys go on and you like and you subscribe and you share these episodes, what that does is it helps our podcast to grow, which allows us to continue to invite incredible guests today, just like Trish. So if that's the case for you, please take a little time and give us a little bit of love. We appreciate it so much. All right, until next time, I hope you all have a very happy and healthy week. Bye.